Today we are visiting the Food Bank of Eastern Michigan, and joining me is the CEO, Kara. Hello, Kara. How are you?
Great, how are you?
Good. Well, tell us a little bit about the food bank for those that don't necessarily know.
Well, the food bank really was established here in 1981
Mm.
as a resource for food for anyone who's doing an amount of outreach for hunger relief. So
Wow.
we have now over 700 partners in 22
Gee.
counties. So between a regular food pantry, soup
Mm.
kitchen, shelter, that's where a lot of our programming started. And then we branched into weekend backpacks for kids and
Wow.
a kitchen that produces meals. So
Yeah.
we do a little bit of everything just in supporting those partners with what they want to do.
Wow. Now, what are you learning about the community in reference to the need?
Well, the need is rising. We just
Mm.
actually received a study from the USDA
Wow.
that has hunger rising at 30% over the past year,
Wow.
which is the highest single increase since
Yeah.
2008.
I was going to say, that's astonishing.
It is. It really is. So when you think about inflation and
Yeah.
everybody working paycheck to paycheck, the price
Right.
of groceries, fuel, everything that's going up, it really is impacting
Mm.
families, especially children. Really now we're at 1 in 5 and 1 in 7 individuals, whether it be adults and children, are experiencing hunger from day to day.
Yeah. What's that like for you when you guys hear those statistics?
Well, it's very just, it breaks your heart. And
Mhm.
one idea that we're probably still not reaching everybody, even with
For sure.
700 partners and what we're doing. We need communities identifying where there's still
Mhm.
places in their neighborhoods,
Yeah.
schools, maybe with healthcare
Mhm.
centers where we're not yet able to help people with the Charitable Food Network.
Yeah.
So we're really looking to bridge those gaps and break
Mhm.
down the barriers that might still exist in communities
Yeah.
for free food.
What kind of advice could you give to help people identify those areas that are still in need?
Well, a lot of times it will go around the school lunch program. If there's children that are involved in a school lunch or breakfast program and there's a lot of need, maybe weekend backpack meals going out,
Sure.
but maybe there's not a local pantry or maybe the pantry's open 1 day a week.
Mm-hmm.
So there needs to be more accessibility for families to get help really 6, 7 days a week
Sure.
in communities across our 22 counties.
Now, what would you like to see for the future of the food bank?
We're really branching more into healthcare relationships too and outcomes for people like the Hurley Food Pharmacy, working with nutritionists and also pairing that with maybe a diet that goes along with somebody who might be pre-diabetic or fighting cancer. What foods can go along with that to help
Oh,
guide that treatment plan for a
Yeah.
medical provider? So
yeah.
we're working a lot with medical clinics now and looking at where the fresh produce and the other fresh items we're able to provide can really benefit people in that way too.
Yeah, why do you think that's so, important? Because I've never heard that where, food banks partner with, medical facilities. Why is that important?
Really, there's so much disparity of health, whether or not people can access health care, where their point of entry is, if they're, again, diagnosed any condition, be it obesity or something with their heart. They really need some extra supports. And when now doctors are screening to say, do you have food in the home? Do you feel like you're having enough meals to support yourself and your family? A lot of times that answer is no. And that needs to go hand in hand
Right.
for the health of the person who's now seeking out their treatment.